Hi, Lori.
Hey, how are you?
I'm good. How are you?
Good, thank
I
you.
was like, I'm going to join right away.
I know. You're like me. It's like, let's just go ahead and do it now. I've
Like,
been
let's
sitting
go.
here.
Let's go.
I've been sitting here for 10 minutes, just waiting. How are you?
I'm really good. Really
Good.
good. How are you doing?
Good, thank you. How was your holiday?
It was, I think I have a little bit of a hard time turning off the off button
Yeah.
since we're brand new and everything, but just trying to find that balance and
hmm
getting some fresh air, spending time with family. I think it was overall very, very good.
Good. I'm so excited. Thank you for joining us. I'm just going to tell everybody, like you're not already famous, but I'm just going to tell everybody a little bit about
Oh.
you. Seriously, this is Dr. Carolyn Robinson. She's a board certified dermatologist. She is a talented dermatologist in every respect. If you read her bio, you just think, wow, I've done nothing at all with my life. But particular interest in hair loss, which I think is really interesting, preventative skincare, ethnic skincare. She's an active advocate for diversity in dermatology and in the beauty industry, which I think is incredibly important for us right now. And, you know, an advocate for inclusivity in healthcare, which is also, I think, becoming more and more evident to all of us with everything that's going on currently. She's been featured by numerous media outlets, too many to mention. And as if that wasn't enough, she just opened a brand new dermatology practice in Chicago that is unbelievably beautiful. I
Thank you,
have to get
Lori.
there. Yeah, I'm going to have to come see it in person. It's absolutely gorgeous. I just cannot believe it. So congratulations on all of that.
Thank you.
Yes, yeah, just amazing. So I was telling some people earlier today at work that, you know, you're that new generation of dermatologists, female dermatologists, thank goodness, that are doing things like so differently than, you know, we did 30 years ago, and just changing the way that that you manage a practice, that you open a practice, the way you see patients, and the way that you view and treat the patient. So we want to hear all about that. I'm so excited. So, you know, tell me whatever you want to, but I think I want to know a little bit about, you know, your path to medical school, and what was that moment where you decided dermatology was where to be?
Yeah, I think like many of us, and thank you for having me. Amazing introduction.
Oh,
First off.
absolutely.
I think like many of us entered into medical school, you know, we wanted to help people. We didn't know specifically how we wanted to do that, but we knew that we wanted to do something. And so I was exactly like that. But I think the thing that drew me to dermatology was just I saw myself wanting to do something different every day. I get really bored really easily, and with dermatology, a lot of people don't realize the breadth of the specialty. There's over 3,000 skin conditions. There is oncology, there's cosmetics, there's pediatrics to some degree, there is surgery. And so I found myself very interested in the fact that each day was very different, and coupled with the fact that we were able to help a lot of people from all walks of life and all ages. So that was a huge part of my decision to pursue dermatology.
That's amazing. So, how hard is it? Is it, because I've heard, right? It is one of the most difficult disciplines to get into, and it is absolutely, it's the most competitive, and it is the most difficult.
Well, I always tell, medical students and residents that I'm talking to, I say, once I decided on dermatology, I actually tried to find something else to be interested in, because I only realized secondhand how competitive it was. But then, when you fall in love with dermatology, then there's nothing else that can really like satisfy that kind of craving. So I decided to just go for it, even though it was super competitive. And I encourage all students to do that. I mean,
Yeah.
you have to try.
Yep.
The worst that you can hear is no. And it's a no if you don't try.
It's always a no if you
It's
don't try.
always a no.
Right. I know. And I think yeah, I've worked with someone for a long time that says if you didn't fail today, you didn't try hard enough. So
Right.
I know,
Yeah.
and no is never no. It's, oh, I still didn't find the right way to say it, but I know I'll get there eventually. So tell us about your office. I
Yeah.
know that, you know, we've talked about this a little bit before. You were set to open this brand new, amazing practice right before the pandemic shut down, and you very quickly were able to, you know, do it differently, and do it incredibly successfully. Tell us about that.
Yeah, it was actually it's been a whirlwind. Lori knows, you know, we talked about this, but it's been a little bit of a whirlwind because I had been planning this for about a year, and I'm a perfectionist, like a lot of people out there. I had a timeline, and it's like you cannot have a timeline in a global pandemic. You just can't. So
No.
you can. So I think that we did a good job of pivoting, which I've had to pivot a lot, you know, in my career. And I think that that's a good thing. You only learn from those experiences. And so what we did was when the pandemic hit, we like took a look at how we can really help people, but still keep with all of the guidelines. We want to keep people safe. We want to encourage social distancing. So we developed a virtual component to our office that launched before our physical launch.
Nice.
And that was really great. And people really, really liked that. And that's still a part of our practice now that we're open. A lot of people are taking advantage of the virtual option as well, you know. And I think, well, just backing up a little bit, when I think about tone, I've been talking to people about this, that I think that I was thinking about this concept for a long time before I actually realized it. Like, there are a couple of core values that we have at Tone that I really think I've had throughout my medical career. And one of them is patient education. We strive to really, like, each visit, I'm talking about the science. I'm not looking at a person and thinking, oh, well, I don't know, like, if this person's medical literacy is here or here. Yeah. I'm just going to empower you to have the knowledge to understand your condition, and to the point that I want patients to leave the office feeling better than they came in, not because the treatment has started, you know, they haven't picked up the prescription, they haven't done anything, but they feel like they understand what's going on. And that knowledge is very, very, very empowering. And that's really what we're trying to do. Yeah. Head Tone.
Yeah, I like that, because you're, you know, I never thought about it that way, but one of the things you go into an office with is you have something wrong, you don't know what it is, and there's a fear, and there's like a lack of knowing. And, you know, if someone can leave the office with more information, knowing what it is, knowing how it can be addressed, like you said, before they pick up a prescription, before they start anything else, you've already addressed that fear. Right. Or the lack of understanding, which I think is huge. And I love that. And I think that, you know, you should talk to your patients in a way that, you know, assume everybody can understand everything you're saying. And then when they ask for further explanation, great, explain it. But, you know, give them all the information so that they kind of know what's going on. I love that. That's amazing. So, you know, on that, how long, well, I mean, now that you're open again, let's go with that. You know, what are patients coming in with? What are they asking for? What are their biggest concerns?
Yeah, I've actually been quite surprised. I think that during the pandemic, since we were shut down for so long, I mean, we still are in the pandemic, guys. But since we were shut down for so long, I think people had a lot of time to really think about their skin, start to prioritize things that they wanted to do with their skin and their skin health, and even their scalp health. You know, alopecia and hair loss is one of my subspecialty areas. And so we're seeing a lot of people coming in, and I'm laying out like the long-term treatment plan. I'm saying, we're doing this now, but these are all of the other things that we can do to really impact your condition. And I'm having patients say, let's do that now. I want the full court press. I want all of it. And I want, you know, we have to pace ourselves a little bit. But I think that there has definitely been a built up angst and desire for treatment in general during this.
Yeah, definitely. And I know we've all talked a lot about the fact that we're all seeing ourselves a lot more than we ever really wanted to, and we're picking it apart. I mean, you know, on a normal day, I look in the mirror like twice just to make sure there's nothing weird going on.
Right.
And, keep
And
going,
you keep
right?
it moving.
Right. Just keep going, whatever it is, it'll, you know, it'll go away. But now you're like constantly looking at yourself on Zoom or on this, and you really do start to, I think, overanalyze everything. But what, you know, here we are in summer. We've been locked up for a long time. Now it's summer and there's sunshine, and oh my goodness, we all want to run out into the sun. You know, how are you talking to your patients about don't get too crazy, don't get too carried away, and here are the things that could happen if you do?
Right. Well, one of the biggest things is sun protection, and just the conversation surrounding that, like what's the best sunscreen? How often do I apply it? All of those questions are starting to come up, and they come up around this time, but really we should be doing it all year. I hope everyone watching knows, like, this is not a summer specific issue. We should be doing this all year. We should be wearing sun protection. And then issues with hyperpigmentation, really patients concerned about like the little sunspots that we're getting, all the way from that to melasma or severe stubborn hyperpigmentation. We're seeing like PFB, pseudofolliculitis barbae, where you have the ingrown hairs and everything. So I think the two most common things we're talking about right now are hyperpigmentation and laser hair removal.
Right.
Because what are you wearing? You know, people are like, oh, I need all of this hair gone. I need, you know, I want to wear shorts. We're having all of those conversations.
All at one time, right?
All at one time.
Oh my goodness. So, so on the pigmentation concern, like what is your go-to course? I know you like Cyspera, and obviously sunscreen, because sunscreen is a must all day, every day. Tell us about other things that you do for your patients.
Yeah. Number one is, I find that there's this misconception that when you have hyperpigmentation, you just need to like scrub, like use the harshest cleanser and just keep working at it with, you know, all these over-the-counter exfoliants and scrubs. And I find that I'm taking a lot of patients off of things, like off of their cleansers. Let's do a gentle cleanser, and let's look at some specific treatments for hyperpigmentation that are evidence-based. So if it's more mild, we'll do an antioxidant with their sunscreen. But if it's more severe, we will definitely incorporate Cyspera and even of the other pigment reducing treatments. Maybe we will add laser if there's hair there, and we can get two birds with one stone. But often I'm like a lumper, not a split. I like to hit it from multiple angles, and we know that with the pigment pathway, there are multiple angles to impact that hyperpigmentation. So I utilize all of them. So oftentimes patients will leave with sunscreen, antioxidant, Cyspera, a plan for laser or chemical peel. We're doing all of it. And then we can peel away what we need to for maintenance.
Right. I love it. Tell me, like, what do you like about Cyspera versus other pigment products that you use or recommend?
It's fast. I think it's way faster than a lot of the pigment correctors on the market, and patients want results. And so I think that I haven't really had a patient who's been unhappy with it. So that's really a testament to how quickly it works, because, you know, when you try a new product and it's not working fast, you're like, oh, let me just try something else. So that's one thing I like about it. And I do like that patients are really able to easily add it to their routine because of the short contact. It's not a burden. It's not like, oh, I forgot to put it on. It's 15 minutes, rinse it off. Very simple to integrate into their routine.
Yeah, I think it's a fantastic product. And somebody's asking what Cyspera I kind of just jumped ahead, right, and assumed everybody knew.
We're just talking,
I
like
know.
we're just like.
I know. Cyspera, it's a product that that our company distributes in the U.S. It's for stubborn pigmentation. This active ingredient is cysteamine. It's it's an endogenous molecule in the body, and of course the form that's in the product is a synthetic form. It's applied to the skin for 15 minutes a day, then washed off. As Dr. Robinson mentioned, it's short contact, but it has astonishing, impressive results on hyperpigmentation of all sorts. And what's even really, really advantageous about it is that it doesn't have a lot of the side effects that some others might, and right. It's safe for all skin tones. If you want to talk a little bit more about that, I think that's
yes. Really yeah, definitely. It's so sometimes you get a lot of irritation with other products that are meant to address pigment, and so I want to avoid that, because irritation means inflammation, and inflammation means that there is the potential to hyperpigment again. So we don't want that, like kind of like we are trying to treat the hyperpigmentation and then it's this circle of that we end up inducing more hyperpigmentation in the process. The other thing is that it's really like, in addition to it being really well tolerated, it's just so easy to integrate. Like we mentioned that it's 15 minutes, it's short contact, it's not, and it acts quickly so that patients don't have to wait around for wondering if it's going to work. Lori, I meant to send you, I was going to post today. Guys, it's been a crazy day. It's been actually a really crazy day. I was going to post, a patient sent me an amazing before and after. So you guys look out in the next like 24 or so hours, because I'll put the before and after on my page, and I'll put like a swipe up link in my stories so you can purchase or learn more about Cyspera, which is, I think I saw someone say, is it OTC? It's not really, like, so a lot of us dermatologists carry it in the office. So we call that physician dispensed products, which have a little more cred to them, right? They're like they're more evidence-based. There's more science and research that goes into this. And that's what I'm about. I'm a science nerd.
Me too. Just not a dermatologist, but me too.
Just like, so just a baseline. It's fine.
Yeah. Well, but it's, it's really important. And I think that you bring up a really good point, is that, there are so many skincare products in the world on the market, and we forget, because we know what works and we know what doesn't. We know kind of what ingredients to look for, and we know what concentrations to look for, and we know the difference. And we forget that if you're, the average consumer that's not a doctor, not an esthetician, doesn't work in our industry, that it's a
lot of noise.
Yeah,
it's a lot of noise.
It's just, constant from the television and magazines screaming, this works. And, some of the commercials, like when you listen to them, they're very interesting, dermatologist approved. Well, what does that mean? Works in 1 week. Well, works on what? In 1 week,
And to what extent? Yeah.
Right. So it's really frustrating. So what's really important is that, there is science behind it, and there's solid science that says, these subjects used it for this long, and at 4 weeks they saw this, and we can measure it, and we can take pictures of it. And at 8 weeks they saw this, and we can measure it and take pictures of it. Right. And those are the things that are really important, and that's why it's in your office.
I mean, I think that's so important, because with tone, I really want to be able to tell a patient, this is going to work. And because they'll ask me, are you sure, is this going to work? And I want to be able to confidently say this is going to work, and give like a time frame surrounding it. And this allows me to do that, which is why it's in my office and a lot of dermatologist office.
Yeah. Obviously. So if somebody asked, is it better or safer than 8% hydroquinone for dark African American skin? What would you say to that?
I think it is safer because the government regulates hydroquinone, and the prescription strength, dispensed prescription strength is 4%, but you can compound it at higher percentages. So if you are reaching an 8%, that's a compounded medication. That's not a straight prescription medication, and that does carry some risks with it. Obviously, this is a conversation you should have with your
Right.
board certified dermatologist, but I think that it's important to consider that this is not prescription, but it is medical grade, which means that it is evidence based, and that's a distinction to know about.
Mm-hmm. That's what's important too. And I think the exciting thing for me when I, became an esthetician and went into skincare is that there are things over the counter, well, not over the counter, but things that are not a prescription that do make a difference to our
Right.
skin, right? Whether it's a really good hydrator, an anti-aging moisturizer, a well-made sunscreen, an antioxidant, a product for acne that's not prescription. There are many lovely, really well-made products that can be dispensed from your office that are not prescription that do make a difference. And, to me, the biggest difference to those products is that they're always more enjoyable to use. Right?
Yeah.
If it's not a prescription, it applies better. Maybe you can wear it under your makeup, or you use it at night and it doesn't have a funny smell. They're always going to be more cosmetically elegant than a prescription that, that could do something similar.
Right. I think that the experience is important, right? That's like what I'm striving for too in the patient experience in the office. So the products, I think consumers are looking for just that stamp of approval from their doctors. I think that in the past, maybe whether a product was prescription or OTC was a little more impactful, but now I think that consumers are really, really open to what is just like getting that stamp of approval from my dermatologist or whatever, my other physicians. And so that's why it's so important for me to have medical grade skincare in my office, so that I can say, after the visit, you should use this cleanser, you should use this moisturizer, you should use this sunscreen. And they'll say, where do I get that? Right? Right over there. For your convenience, because we know that it works, versus something that you purchase elsewhere.
Yeah, I think that compliance goes way down, right? If I leave your office without something, I'm just going to stop at Sephora or
Lori, I've seen a patient in Ulta before.
What did you say?
Oh my God, after a visit, I saw a patient in Ulta. I hope this patient is not tuned in right now. I'm sorry.
Right.
I'm sorry. I just ducked in another aisle and I didn't want to embarrass you.
Yeah. Right. Oh my goodness. Yeah. It's, it's when it's on your mind, you will keep looking for the solution until you find it. So if I come to your office and we talk about this concern, and you mentioned that there are, a few things that you could do, but you don't sell products in your office, I'm thinking, she said there's a product that I can go get somewhere right now, and I'm going to do that on the way home because I want to, get this under control as quickly as I can.
Yeah, you want to cross that off your to-do list.
Yeah.
And then you walk in and you're confused and you just buy, like whatever moisturizer or whatever sunscreen. And for me, I'm invested in how your skin improves. So I want to make sure that you have the right thing. And it's just easier if you leave with that thing and we know that that's what you're using. There's not really even a question.
Yeah. And I think that becomes even more important if you're having a laser treatment. I need to know what you're leaving the office with. If you're having a laser treatment, microneedling, a chemical peel, I want to be able to give you everything that you're using so that I can sort of predict, your recovery process and anything that you might call me about that didn't go right. It's just so much easier that way. And then those are the same products that you need to keep using once you're healed up from it. And I think, technology has gotten a lot better. We're a lot more knowledgeable about skincare products, but with that comes a lot of choices that we didn't have a long time ago. And, I still trust my dermatologist to help me with those choices. So I recommend that we all do that. So talking about sunscreen, because that's just very important to me. For some reason, I've been using sunscreen and Retin-A since I was 13. It's just a habit.
That's a good habit.
Right? I know, right? Thank goodness. It's my only good habit, but it's a good habit. A lot of people will say, oh, I don't go out in the sun. I do wear sunscreen when I go out in the sun, but I don't go out in the sun. And I think that, we need to understand that if you go to the mailbox, you walk the dog, you go to the grocery store, you're going out in the sun. Going to the beach is going out in the sun.
Yeah.
So walking the dog, you're still in the sun. And even now with us working at home more, the sunlight coming through the window is a concern as well. So, tell us what that conversation is with your patients and what are some of your favorites?
Lori, there's so much there. There's so much there. I could talk about this all day because I think that people are like, oh, I don't go out in the sun. I don't burn. I'm not at risk for skin cancer or, something crazy. But I say, okay, if you go out into the sun unprotected, it's not just a burn you're at risk for. It's skin cancer, it's hyperpigmentation, it's dullness, it's skin laxity, it's wrinkles, it's photo aging. It's like the list is very long.
Right.
The sun causes skin damage. Like this is established.
Yeah.
And the other thing is that people don't realize that our sunscreens now protect us against they protect us against broad spectrum UV light. But a lot of sunscreens are starting to incorporate pollution protection, infrared, heat. So these are things that we're exposed to indoor and outdoor. And so it's really important to have that in your routine to protect you against all of those potential insults to your skin that can happen, whether you're inside or outside, whether you're sitting in front of your computer screen on your Zoom or you're out checking the mail or at the beach. You should just be incorporating that into your routine.
Yeah, you like you said, I have blue light filters on all of my appliances in the house, my computer, my laptop, my phone, blue light filters on my glasses. And then, I put on a sunscreen before I walk the dogs at 5:30, 6 o'clock in the morning. I put on a sunscreen.
You were diligent.
You have to. I mean, it's it creeps up on you, but then it doesn't creep up on you. You don't see damage, and then suddenly one day you look in the mirror and you think, who is that, and what happened?
It does.
And it's just that accumulation, right?
Right.
And then, goodness, and there it is. And so our sunscreens I love just because they have all of those things that you talked about. And I think that's what people don't realize. It's that it's not just UVA and UVB anymore. There's infrared, there's pollution, there's ozone, and blue light. And blue light is what's coming off of all of our devices that we use so much. And, regardless of where the energy is coming from, whether it's the sun or your phone, they're all stimulating that same destructive process in your skin. They're all creating free radicals.
Free radicals.
Yeah. And you're getting all those ugly things that you don't want to have on your skin, all the lines and wrinkles, all the spots. That's where it's coming from. It's coming from the sun and the environment.
Yeah, Lori, and I told patients that we need to establish some good groundwork here. We need to get our skincare solid before we even get to the treatment. So a lot of times we're putting the cart before the horse. We can't talk about treating the hyperpigmentation without talking about gentle cleansing, sun protection. If we're not doing those things, then the hyperpigmentation treatment is not going to work.
Do you have patients that think that they can have a laser treatment and that will fix it and then it's gone? and then they
Yeah.
don't put on sunscreen anymore, or they don't even have
Or
to
like
do.
a chemical peel or something. And the conversation is, no, we need to do these things. This is part of your treatment. So I don't even, it's not even like, do you want a sunscreen? This is actually part of the laser treatment. This is part of the chemical peel treatment. This is part of your treatment for hyperpigmentation. Absolutely.
Yeah, forever and ever, right?
Forever and ever.
For as
How
long
long? Forever.
forever. Forever. Someone's asking, what's a good gentle cleanser? Well, obviously, we like Daily Soothing Cleanser, right? It removes makeup.
Oh, I love Daily Soothing. I've been doing that probably like the last half of quarantine. I've been using that. And then I did a chemical peel recently and I was like, oh, what am I going to reach for? I need like a really gentle cream. That's what I was reaching for. So I love that. I like dermal repair cream just because it's nice to have a nice, like fragrance free, gentle, thick, moisturizing cream. You should always have a gentle cleanser and a thick moisturizing cream on your nightstand, with your sunscreen.
And where and someone's asking, where can we get these lovely products from?
So they are medical grade. They are physician dispensed. You can get them through your dermatologist. In fact, I advise there's a lot of experimentation, and I don't like when people spend money and they don't have to. So I would really recommend that if you have been spending a ton on skincare, that you just have a simple conversation with your dermatologist. You're not like imposing on their time. This is part of your treatment. If you're going to a dermatologist and you're getting any kind of treatment, you should have a skincare recommendation. You should have a skincare routine. For me, like everyone is leaving with like, this is what I wash my face with. This is my antioxidant. This is my sunscreen. You should know exactly what you're doing instead of putting in the guesswork and purchasing a lot of stuff. So when you ask me where you should get it, I just don't want you to spend a lot of money. I just want to make sure that you are getting something that's really, really going to fit your skin type and your skin concern and take the guesswork out of it. A lot of us have those services available in our office. We have that at Tone where we call it skincare coaching. A lot of offices have skincare consult or skincare curation so that you don't have to do the wallet work.
Right. And you can buy them on your website too, right? Because you're in our affiliate program.
Yes.
You can get products on your website.
So tomorrow, and when I post the before and after, if you've been tuned in this whole time, I mentioned earlier that I'm probably going to post a before and after of Cyspera that is really amazing. A patient sent me these photos the other day, and this is only after a month.
Okay.
So I'm going to post that, and then I'm going to put in my stories a swipe up link for Cyspera, which is really great, I feel, for stubborn hyperpigmentation, like hyperpigmentation from acne, that post-inflammatory. If you have a lot of acne and you just really, really want to clear that up, this is what the patient had. We'll put the swipe up link for that. But if you want like a full routine, I'm in the SENTE affiliate program. You should talk to us about coaching first or curation and really decide what those components of your skincare routine is so that you don't have to do the guesswork. And then you can purchase everything online. Everything is virtual and online these days. So it's really easy.
I know, it's amazing, isn't it? So there are some questions here that are not directly related to skincare, but they're still, related to what we do. So 2 questions. What are the purpose of fillers in the face? And then what are your thoughts on using facial oils?
Okay, great. So fillers are hyaluronic acid primarily. There are lots of different ones, but the most common one is hyaluronic acid. And basically what they do is they revolumize. So when we get wiser, because I don't use the other word, when we get wiser, we lose volume in certain areas in our face. And we also have these things deep, deep, deep under the skin called fat pads that start to descend a little bit and break apart. And so we get kind of like some volume loss here and some volume gain here. So the fillers are great to restore volume. We do like a lot of cheekbone, you know, angling. We do some jawline definition for fillers. There's indicated areas to do that, but that's the main purpose, to revolumize areas of the face that may have lost either fat or actually bone. We can get bone loss as well. And then like facial oils, that's like way on the other side.
Yeah.
I think I actually do like facial oils. I don't think they're for everyone. You have to have a certain skin type that's maybe a little more dehydrated, a little more oil loving, not too sebaceous or too, you know, too much sebum, too oily. And I do think there's a lot of great ones that have been around for decades, have evidence that they are anti-inflammatory or help with some specific skin concern. Too many to kind of go through right now, but one of my favorites is rosehip oil, which has a lot of evidence behind it.
Yeah, and that one's been, I mean, rosehip has been, you know, around for
Centuries.
years.
Yeah.
You know, many different versions. So yeah, I totally agree with that. So I want to switch just a little bit, talking about hair loss, especially in, you know, in female patients, but obviously male patients as well. Because I think that, you know, we don't think about the fact that it's, you know, we see our dermatologist for hair loss, and it's becoming more prevalent for a lot of us for different reasons, whether it's, you know, stress, traction, hair loss. You know I do a lot of hot yoga, so my hair is like right here all the time, right? And
right.
I can feel it, like, you know, you can
Me
feel
too. This has become my
that.
signature. So guys,
right? Yeah. So talk about, like, you know, just talk about that in general. Like, what do you see? You know, how's it changing? Like, what is the hope, you know, for people with, you know, with some form of hair loss?
So we're seeing a spike, you know, because we are all under stress. And stress doesn't necessarily cause hair loss, but it definitely makes it more prevalent, more difficult to treat. It's kind of like it's like the elephant in the room when we're having a conversation about hair loss. And there are over 27 different forms of hair loss. Did you know that?
I didn't know.
There are a lot. And so part of the conversation is really just trying to gather the health history, the family history, and making sure that we are diagnosing and getting that correct, you know, bucket of hair loss. And the most common, I would say right now that we're seeing a lot of telogen effluvium, which is a specific type of hair loss that tends to be more linked to stress. It can be stress on the body, like blood loss, pregnancy, surgery, or it could be physiologic stress, like I'm just stressed out.
Right. Right.
And so you get a lot of shedding with that. And sometimes the most common scenario that I see it is that starts to uncover another form of hair loss, because hair loss likes to run together with other things. So female pattern hair loss and telogen effluvium can sometimes run together, and that's when you start to notice it, because maybe you didn't notice the thinning of the female pattern hair loss, or maybe you wouldn't have noticed the shedding of the telogen effluvium on their own. But once they start to come together, then it's really dramatic shedding, it's really dramatic areas that are thinning, and that's where we have to really intervene. The traction, I am not seeing as much traction lately. I don't know, guys. I don't know if we have other derms on here. I'm not seeing, maybe
Right.
later. Maybe later.
Maybe because people couldn't go to yoga, right? Or we just
Yeah.
wear, so we didn't have to pull it back that often. Because
I
I
haven't
didn't
been seeing that.
for 2 months.
Yeah. And of course my scarring. So in addition to hair loss, I specifically see a lot of scarring hair loss, and that's a whole separate category. There's lots of conditions in that category, but one of the most common that I see is called centrifugal cicatricial alopecia, or CCCA for short. And that condition is plagues Black women particularly. It's an epidemic in the Black population. And so the biggest thing is we have to shut down the causes of the inflammation. We have to shut down the causes of the shedding and the hair loss. And so I tend to prescribe a lot of different treatments at the same time because we're addressing that inflammation, we're addressing the nutrition, the micronutrients and the macronutrients, we're addressing stress, we are addressing all of these different things up front so that we don't lose any time, because time is follicles and time is hair.
Yeah, nobody wants to lose their hair. What are the causes of that particular type of hair loss?
Yeah, they're genetics. We know genetics plays a role, but like all of the conditions where we, tend to say genetics, there's also always an environmental component. And this has really just been recently described. The genetic component has been emerging in the literature within the last 5 years or so. So I think that we have a lot more to learn about CCCA, especially the environmental component. But we know that we can influence it with protective measures like minimizing the manipulation of the hair, minimizing the daily styling, minimizing styles that cause traction, and really instituting some medical therapy early. That makes the hugest difference.
Nice. God, it stresses me out just thinking about hair.
I don't want you to be stressed.
No, it's panicking. And I will say with everything that's going on now, like I don't do my hair that much. I wash it, let it dry naturally. It's out of control, kind of curly. I'm happy with that. Perfectly happy with that. So
that's perfect. Air drying is one of the best things you can do.
Mm-hmm. Yeah, I know. It really is. And getting used to that is pretty interesting. Somebody's asking about hair loss in the beard, particularly. Like, what happens there? How do we address that?
So there could be many causes there, but one of the most common that I see is alopecia areata, which is an autoimmune type of hair loss that can cause little focal areas, little patches of smooth balding, either in the scalp or in the beard. And we have a lot of interventions that we can do in the office, prescriptions that we can recommend for that. Sometimes we do injections of steroid to kind of calm down the inflammation in that area. So that's one of the more common things that I see.
Interesting. There's it seems like some doctors want to do the steroid injections and some don't, and they have other ideas, but it's good to hear that's still a nice, way to address that.
Yeah, I think it's a great solution to calm down the inflammation quickly, especially when it's out of control or you don't know like the extent of it. It calms them down very quickly, and then we can start to intervene with other medications.
Got it. Very interesting. That's good to know. What else is in your plans for the next couple of months this summer? I mean, you've opened a practice. You're doing just a lot of amazing work, I think, very, very quickly. What's coming up that you're excited about?
Well, we're going to have our grand opening, like ribbon cutting. We're trying to do it very socially distanced and playing with the idea of doing a virtual component to that too. Mm-hmm. So I'm excited about that. And I think just growing the practice and really getting to know everyone in the community and really expanding the offerings that we have. Right now, we have a lot of core offerings with the chemical peels and the laser, but looking for innovative things to add to the practice because we want to offer those things to patients and be ahead of that science and technology that we're delivering.
Mm-hmm. As you are. You're amazing. I know. There's another question here. What do you usually recommend for hormonal acne from PCOS, for example?
So you definitely want to address this with multiple ways. I think after this conversation, everyone's going to realize Dr. Robinson likes to address things from multiple angles.
Yes.
So I talk about diet, dairy, and high glycemic index foods, I think play a huge role. I talk to patients about topical retinoids. I think there's still a place, even in PCOS-induced acne, to have a topical retinoid that unclogs the pores. I talk to patients about spironolactone. We go through the whole gamut. Chemical peels, maybe we'll laser a juicy pimple. We will never pop, but we might laser it.
That's so interesting, you know. Years ago, and I've had acne since I was 13, and it's just really interesting for me to see like how our knowledge of acne, what causes it, what aggravates it, has changed. Some has changed, but some of it has gone right back to what my dermatologist told me, you know, 40 years ago. So it's kind of interesting to hear that. But I think one of the conversations that has never come up is, you know, what role does diet play? Does dairy play? Does sugar play in acne? And you know, as early as 10 years ago, I had dermatologists telling me that, oh, diet makes no difference at all in acne.
Yeah, I think I was taught that.
Isn't that interesting? Because to me, diet affects everything. Your nutrition affects everything that you do, right? And I mean, if you have a bad diet, you will see that on your skin, right? Mm-hmm. Not necessarily in the form of acne, but just you don't have glowing skin, you don't have healthy looking skin. When you have a diet that's full of like fried foods and, you know, heavy fat laden foods, you can see that on your skin. And when you switch to something that's kinder to your body, that inflammation goes away, you see the difference. So I'm just so thankful that, you know, that we know that now, and that we're getting to that because of all.
Oh, yes. That. Like the research is percolating. It's there. And not just with my acne patients. I think with every patient, we're having a conversation about diet. Because if you have a skin condition that has chronic inflammation at its core, there is an opportunity. I tell patients, your diet didn't cause this, but there's an opportunity there potentially to improve this condition, improve how you respond to it, and also just improve your health in general if we start to take these things into account.
Yeah, it may not be causing it, but it's not helping it. And, you know, if you're treating like the whole person and you're treating the health of that person, you know, an unhealthy diet certainly doesn't help. And someone's asking, what do you recommend for healthcare professionals suffering from maskne, during the pandemic?
Oh, this is a big thing. Actually, we have been seeing a lot of maskne, and the biggest things are you have to take a mask break. This is hard. You're a healthcare professional, you're at work, but maybe I know for me, like I wear a mask all day, but I noticed that I was wearing it in my car, like driving with my mask. I'm like, wait, this is a mask break time. I'm going to take a mask break. Or could you, on your lunch break, go out? Like, is there somewhere that doesn't have a lot of people that you could go outside and just take a mask break? Maskne is caused by occlusion. So the oil and the sweat and the dirt from the day are sitting there, and you are driving it in with your mask. And there's nothing, you have to protect yourself. There's nothing that can be done there, but the breaks can be really, really helpful. After that, you have to start some treatments that are really going to get that oil and that dirt out, moving out of the skin rather than sitting in. You should never come back from work, take your mask off and go to sleep. Please wash your face. Did you see Lauren's like, no, wash your face. Use a gentle exfoliating cleanser, like an alpha or beta hydroxy cleanser, or use a topical retinoid. Adapalene is now over the counter. There is no reason for you to not be on a topical retinoid. And moisturize. Counterintuitive. But if you do not moisturize, your skin will compensate by producing more oil, and that oil will be driven into your pores by your mask, and that's not a good situation.
No, I think some people too like don't realize that depending on the kind of mask you're wearing, it's trapping oil, but at the same time, it's drying the surface of your skin
Yeah.
with just the constant motion or just the constant contact.
Yeah. We're
Kind of
getting like dry lips, you
just,
know? It's like counterintuitive. It's like I have a juicy acne bump here of dry lip. What's happening?
What's happening? Fix it. I know. Fix it. Dermal repair cream is great for that because it's a good hydrator, but you don't get that thick moisture on the surface of the skin. So a couple of questions here. Why do I get acne only on one side of my face? I love this question.
Oh my goodness. I hear this all the time. And I go through every possible scenario and we never figure it out.
Oh my God.
You know, it's like, oh, is it my pillowcases? No, I really don't think. I think that it just is. There may be some difference in the skin microbiome on one side or
Yeah.
the other.
Could be. Yeah, could be.
But
Yeah, years ago, my dermatologist, he would go through all that, the same thing too. And like now it's, well, it used to be, where do you hold that phone? The phone. Like, did you do that? And prop it up on your chin. But, in cases it's been like your cell phone on your cheek, do you sit at your desk all day like this?
Yeah.
Do you navigate on your computer with this hand and then touch your face? But it is hard to pinpoint. Hairstyling products,
Yes.
especially back in the 80s, they were just vicious,
The
and
pomades and all that.
yeah, you would get acne. Like, used to see a lot of people that had acne on their back from their hair
The
all
hair.
loose and gel down the back or like around the hairline. So I think for me, it's, you think about all the things that you repeatedly do just on that side of the face, and is there something that that you suddenly think of that could be it. And then let's see, is Cyspera, let's see, what are some things that can develop certain stubborn pigmentations, and can Cyspera address it, and is it safe for all skin tones?
Well, it is safe for all skin tones. One of the most common things that I treat is melasma. And then I would say that I use Cyspera for, and then I would say post-inflammatory hyperpigmentation or just stubborn hyperpigmentation, because you have to realize that anytime that you have inflammation and you have a deeper skin tone, that you are at risk of developing persistent hyperpigmentation in that area. So it could be eczema that led to it. It could be a scrape or a burn. It could be, a scratch or an old injury. But if there's some area that it's been months to years and it hasn't cleared, then you're coming to me. We're doing Cyspera.
Right.
We're just doing it. And but we talked about earlier that I like how fast it works. So even for my acne patients, the acne hasn't been there that long per se, but there's a lot of areas and there's a lot of areas of pigmentation that it's just kind of a nice, like, clearing to that area to use Cyspera. And I love that you don't have to spot treat it per se. You can apply it broadly, and that's really, really helpful when there's these like pinpoint dark spots that come along with acne.
Yeah, because there's little chance of being able to just hit those little brown spots consistently every time with it. And I think, what I love about Cyspera is the fact that it improves the pigmentation, but it does not alter the natural tone of your skin. Nobody wants to look like a piece of paper, from using too much of a pigment product over the years. And it happens. With certain products that can certainly happen. But what I love about Cyspera is that it's so safe for any skin tone, and it just corrects that pigmentation and leaves your natural skin tone intact, because that's exactly what you want to do. And then you can use dermal repair with it, because somebody's asking to answer. You can use dermal repair with it because it replenishes the deep hydration. It also helps a little bit with inflammation. So you're able to cover inflammation, which is a concern with pigmentation, using the Cyspera and then the dermal repair. And then someone's asking what type of peels you like for PIH, or would you do something different than a peel?
Oh, I love peels. I don't think we use peels enough.
No, yeah.
So I talked a lot about that. I approach pigment from multiple angles, and a peel is not something that we do every day. It's every 4 weeks, maybe 6 weeks if it's a more aggressive peel. So in the meantime, you're doing your skincare, you're doing your sunscreen, you're doing your Cyspera, and then we can address things with a peel as well. So which peels do I like? I like to layer. I customize, probably every patient gets a customized peel. I use a peeling system where I can decide, which layer do I want to put on? Do I want to put on something that has a bunch of brighteners? Do I want to put on a layer that has something that addresses acne? Do I want to put on a layer that addresses fine lines? So it's kind of a customized treatment. But for PIH, we're looking at the brighteners. We're looking at lactic acid, kojic acid, and all of the beautiful botanicals that exist that can really address that.
I love lactic acid. That's one of my favorites. And I do think peels kind of, they haven't gotten a lot of good airtime lately. I think when microneedling especially came along, and then some of the laser treatments that are like far less invasive, where they're completely non-ablative and you've just got like 3 or 4 days downtime, that peels just kind of started getting ignored a little bit. But
Right.
To me, like completely, rejuvenating your face takes a little bit of everything, like you
It
said, right?
does.
You've got to volumize, you've got to work on some wrinkles here and there. You can definitely, correct a lot of concerns with lasers, but lasers don't necessarily refine the surface and refine the texture the way that a peel can. So I think it has to be, a nice combination of all of those treatments, definitely.
Yeah, and I tell patients that the peels have two purposes, right? They're going to have the ingredients to brighten or address the fine lines or all of that, but they're also going to cause skin cell turnover so that your topicals start to work better and your skin starts to look better.
Yeah.
So,
yeah,
absolutely.
So important all the way around. Well, okay, so I've kept you now for almost an hour. Oh my gosh,
that went by fast.
Oh my God, totally forgot about that. So really quickly, the name of your practice again, your website, where we can find you.
Yes. So Tone Dermatology, you can follow at Tone Dermatology on Instagram, actually on every channel, Facebook, Twitter. And I'm Dr. Caroline Robinson. You can follow me at C Robinson MD. And we also have our skincare curation service through Tone Dermatology. That's at It's Tone Skin. And our website is tonedermatology.com. So literally you can't forget it.
I know, so good. Like your marketing is amazing.
Thank you.
So that's great. So thank you for your time. I could talk to you forever and ever. And I just wish you all the best in your practice. And please let us know when you have your ribbon cutting, whether it's virtual or live. We want to know. We want to see it.
Yes.
Yeah, and just thank you so much for your time and for you and for all of your work. You're amazing.
Oh, Lori, it's always great talking to you.
You too. Thank you. Have a good night.
Thanks. Thanks, everyone.
Yeah. Thanks, everybody. Thank you. Bye.
Bye.
Bye.